Good morning, New York City, the United States, and everyone joining us around the world via live stream on hot97.com and our free Hot 97 app. The death rate is down in New York State, but it's still very high, according to state health department tracking. Yesterday, the governor announced for the first time since April 1st, the daily death toll, this is just for one day though, was 550. So that's a lot more than a number. That's 550 people who lost their lives in one 24-hour period. Way too many. So far in New York State, we have lost, in terms of lost lives, we've lost more than 3 times what we did during the September 11th, 2001 terror attacks. But the crisis is still nowhere near over. Hospitals are reporting about 2,000 new cases a day, and the deaths in nursing homes are a huge concern. More than 2,700 lives have been lost just in those nursing homes here in New York, more than anywhere in America. And if you have a loved one in a nursing home, if you work in a nursing home, we'd love to hear from you at 1-800-223-9797. That's 1-800-223-9797. Public health experts are telling us there needs to be a better plan in place for more widespread testing instead of the way it's going now. And that has to happen if the state governments are going to allow businesses to reopen and other activities to resume. That's already happening in some states out west, but obviously it's a whole different issue in a highly populated region like New York and our tri-state. Now, how that can happen when there's a shortage of tests and no uniform plan to test the most vulnerable populations and those communities of color and low-income communities most at risk, I don't know. And I don't know if anybody has an answer on that. But we're going to find out more from Dr. Emmanuel Fombu. We call him Dr. Manny. He's a medical doctor and surgeon, best-selling author of the book, The Future of Healthcare. He's also a public health expert and medical futurist. Dr. Manny, how are you feeling this morning about the state of testing? Because we hear there's more tests coming into New York City starting tomorrow from Mayor de Blasio. They'll be coming every week. But there still is it doesn't seem like there's a plan for everybody everywhere.
Correct. I think the biggest concern there is how do we get access of the for the test and who gets the test done, right? We know that we all have to be tested at one point for us to get back to normal, right? So as schools started opening up and work spaces started opening up, we need to test those people returning to work to make sure that either one, they are actively they're symptomatic or not. I mean, if you have symptoms, of course, you probably get tested. But those that are asymptomatic, which means they don't have symptoms, we need to test them to find out if they actually have the virus on them and they could infect other people. Or the third thing being that they actually have been infected in the past and they have recovered, which means they have antibodies. So that'd be very key.
So it seems like there's a lot of confusion, though. So you need to get tested in the first. First of all, do you feel as a public health expert and somebody that surveys this from a kind of a high level and in a big picture, do you think ultimately everyone needs to be tested for this?
Eventually, everyone will get tested, right? The reason why no one is pushing for mass testing right now.
We don't have the test.
We don't have the test, right? And so you will see measures that come in place like measuring body temperature, right? That will become something that should be expected. I had a conversation a couple of days ago with a colleague, or a friend of mine that runs a nightclub in Vegas, right? And the conversation around that was, people come to Vegas, people lay on the pool all day, right? So how do you do body temperature to reopen a nightclub or a bar, right? So people walk in, you want to scan your temperatures. Temperatures are probably high, so it's not exactly, high temperature does not mean you have COVID-19 or be infected, right? So that's a challenge right there on how that test gets rolled out and how often you should do the test.
What about this whole issue, this debate, and I don't want to get into all the politics of it because that's politics, and we're really talking about people's health here and how it's going to affect people. In terms of, does the plan need to be a national plan? Because you can get in a car right now and drive across a state line someplace else.
Unless you're from New York, and then you are required to self-quarantine yourself.
Right, exactly.
I think the plan cannot be a national plan, and it cannot be a state plan. It has to be a regional plan, right? So if you look at New York City, for example, is definitely at higher risk than if you're in another remote part of the country or even in New York State, right?
Right, because everybody's so close together.
Correct. If you're Albany or in Rochester, it's not as dense as New York City, right? So they have different restrictions. So if you look at Florida, for example, Miami and Jacksonville could be completely different kind of areas, right? So you could have the beach close to Miami because it's more crowded, and then you have a place that is more remote that people might actually be able to go out. Even New York City right now, in New York State, you could go to the park still, right? The national parks, you could go out and you could still walk.
You can go to a national park, but you're not supposed to be in a state park or a city park.
Correct. So you could be in a national park. So I was in a national park 2 Sundays ago, right? Just walking around, but you see people hiking, but it wasn't crowded, right? So when people come next to each other, people actually try to split away from other people.
What did you think when you saw that video of the people on the beaches in Florida?
I think it showed how much people lack the knowledge, right? So you think about it. The whole reason why we should not be close to each other is because we know that this is airborne. We know that we could get infected if we are close to other people and we are talking to them and engaging with them. That's the reason why we need to practice social distancing. It's not Big Brother telling you not to go out because for the sake of just doing it. And so when you look at in Jacksonville, when the beach opened in Florida, people were crowded in line and rushing to go to the beach, and they're all happy to be there as if, mommy asked the kids to go out, right? That's the kind of mindset. But that's not the point of it, right? So you could still be on the beach. Okay, great. I mean, if the law allows you to go, but practice this social distancing.
But it's almost as if people, are so happy to just get out of the house and that they just want to be, make it feel normal.
Correct, because when the government says go back to the beach, people think that means the coronavirus left Florida on a plane. That's not the point, right? Someone coming on the beach might be infected and they don't know, right? So you are going there and you're putting your life at risk. And you could not only your life, but you could go back home and get other people infected. So you have to have that in mind. It's about you, protect yourself, right? It's not about the rules in general.
So can we just review the testing, because we're getting a lot of calls and we're getting a lot of questions about who should get tested, how the city's is setting up these testing sites locally. They were at certain hospitals. There were some drive-through things. There were telephone numbers. 311 got overloaded with calls. They were telling people to call after 7 p.m. and before 7 a.m. because they were getting so many calls from people here in New York City who wanted to know about testing. If you don't feel symptoms, if you haven't knowingly been exposed to anybody that tested positive for COVID-19, do you need to start getting all, ramped up about getting a test right now?
No, because there's no reason for you to get a test, right? And I know people want to get a test. In the ideal world, you could go get a test, right? You could walk into Walgreens or Rite Aid or CVS today, and you could buy a drug test, right? And you could buy a pregnancy test. You could buy those tests, whatever, right? So there are tests that are available for you to just go in and get because those are widely available at cost, right? But today, we don't have enough tests. So because we don't have enough right now, we need to prioritize who gets tested. So if you're a frontline healthcare worker,
automatically you should get it.
Yes, automatically you should get a test, right? And I think the test is available for them. Then the next piece is if you were around someone that was infected, then you should get tested as well, right? We talked yesterday about this whole notion of of contact tracing, right? So if you do contact tracing, which means that you were infected and who were you around when you were infected, so those people are tracked. And those people should get tested as well.
Which is what they did with the man in New Rochelle, who was the first documented, definitely not the first case, but the first documented case here in New York City and in New York State. He was basically, this man from New Rochelle that was the first kind of public case that we knew about, I should say. They traced where he worked. They traced all the people that he knew. They traced a trip that he took to Florida. They traced his activities in his hometown of New Rochelle, and then they isolated a certain population there, and they had very, very good results, and he recovered, thank God.
Correct, and that's the scary part of this, right? Where you could see how fast it can spread because people move around today, right? We have planes, buses. You could drive your car. You could go wherever you want, right? Take the train, and so by the time they find out, what about those people and who did they come in contact with, right? So you could see how vast this could actually spread. So that's why it's very important for us, to wash our hands, right? Don't put your hands on your face. Let's still follow those rules.
But let me ask you one issue we've been talking about here with Team Lisa and with Street Soldiers and with all our community contacts too, is this issue of people throwing gloves, throwing their gloves on the floor, on the ground, on the streets, in parking lots, all over the place. There's pictures. We posted some pictures on Street Soldiers of it. There's a lot of people that have seen this, and it's just you see wipes in different places, and it's like every other every other service. Some neighborhoods, the sidewalks and the streets are spotless. Others, especially if it's a big rush like a weekend, and a lot of people find out that the grocery stores just gotten new deliveries and stuff like that. There's just a lot of that around. Can you catch it from people? What should they do when they're taking they're on the move? They use the gloves to go into a store or something like that, and then they take them off. They can't just drop them.
Which goes down to the basic. I think this COVID-19 pandemic is actually making us look at humans as if from a basic level. At what age was it okay to drop your gloves on the floor, right? I mean, it's just basic sanitation practice, right? So wash your hands, right? And once they say wash your hands, people went to the store and bought everything to wash your hands. Right. So what were they doing before, right? And then all toilet paper was gone. Everything was gone, right? So it's just basic common sense that when you drop this on the floor, let's say it's infected with COVID-19 or coronavirus. If you throw this on the floor and someone else comes by and touches it, what will happen when that person touches a doorknob? You might still get infected, right? So it's a community kind of mindset. Please just drop your gloves, properly dispose of them. We talked about this before.
Which is a trash can.
Correct. I don't understand why we don't have biohazard, trash cans around now to collect this. Because we know if this is a biohazard and we know people are touching things.
That's a great idea.
How do you get rid of them, right? Just put it in the regular trash. What about the trash guy that picks up the trash, right? So I think we should think about this more seriously, how we dispose of this.
Exactly. If you're in a neighborhood or you're in a community and you see a lot of gloves on the ground or a lot of wipes, that type of thing on the ground, post it. Post it on Instagram and tag me at Lisa Evers. Or you can DM the picture to me because we want to see how much of this is going on. Because some neighborhoods is very bad. Other neighborhoods, in the sanitation department, they've been doing an outstanding job, collecting everything. And I see those guys working all the time. No matter what hours I'm working or get, out on the street and coming to and from my essential job, they have a lot of work to do. But it's like the other issue that came up too is that somebody had asked me about yesterday was off the air was these recyclable bottles. If you're drinking and you have saliva, you're drinking, you may have saliva on that water bottle, soda can, whatever it is, and then you're just throwing that on the ground. And then people come around and they pick those up or whatever. That's continuing. Is that risky?
Of course. We know that this virus lives on surfaces, right? So if you are dropping things like that on the ground now, especially now, first of all, it wasn't allowed to draw. I mean, you should not be dropping bottles.
In the first place, right.
I know people do, and it happens, right? Or you eat your fast food bag and just throw it out on the window. That's dangerous now because that could be infected and someone's going around helping to keep our city clean and pick up that stuff and gets infected, which might come back to you, right? So we have to think about this from a community effort. We could fight this together. We have to work together.
Do you feel like there's been enough emphasis on that? They've had some public service announcements and things like that. Do you feel there's been enough?
Around disease awareness?
Yeah.
I think there's two sides of it. It's either one, you're very scared of what is happening. Two, you have a better understanding of what is happening. Or three, you don't believe in it, right? So you have three main camps.
And I want to ask you about the third category, the people that don't believe in it, because it seems to me like unless you're an essential worker or a frontline worker or have had a family member that has been touched by this or that you're very concerned they're in like a super high risk group, a lot of people, aside from the fact that they're staying home and dealing with financial issues or whatever, that seems even more urgent to them than these health risks. Like it doesn't seem real is what I'm saying to a lot of people.
Look at things like diabetes, things like heart failure, hypertension. Many people don't even understand what that is, right? And what they should do in the first place, right? So now you're coming in with a new virus that's very sophisticated that doctors don't know much about, right? That they're learning on a day-to-day basis. And so you're dumping this on the general public for them to make sense out of all of this, right? So it's too much at one time. There's a lot of things happening. The government says one thing today and the next day changes its mind, right? Your public officials are just trying to learn and figure it out. So people naturally distrust the system. And so you start seeing what is happening. And so, but it's very important to look at. This is a global crisis, right? You can't have a global conspiracy where everyone in the world, everything is shut down for whatever reason, right? Because everyone is affected by this. Even if it was a conspiracy, the key thing is for you to stay safe and stop infecting other people.
Right, and control yourself and control your family and your loved ones.
Correct. I just understand that this is real. No one is doing this for the sake of just doing make money from doing this. And it's a conspiracy on this. The bottom line is people are being sick and people are dying. If you are in New York City right now in the epicenter of this, you know it's real, right? There's no time to believe in conspiracies right here because you see people dying.
No, exactly. All right, Dr. Manny, let's bring in Eric Adams. He's the Brooklyn Borough president, and he's been very active in speaking out about especially what the residents of Brooklyn and New York City need during this crisis. Jack, we have him up on the line? Okay, great. Hi, Eric. How are you?
Hey, Lisa. How are you doing?
I'm fine.
I hope you're well.
Thank you.
Great,
Good morning.
Great. Good morning.
And Eric, we're joined in studio by Dr. Emmanuel Fombu. We call him Dr. Manny for short. And he's been helping us understand a lot of the medical issues around this and answering a lot of questions from our audience. As you see this whole pandemic play out in New York City, and then of course about a week and a half ago we heard that communities of color, that low-income communities, have a much higher, double in some cases, the death rate of whites and of more affluent communities. What are your biggest concerns right now?
Well, when we entered this, if you go back, and it's almost as though we could follow the social media threads, and when it first hit here, and I heard the city talk about, separating the city, dividing the city into two essential groups. One was defined as essential employees and non-essential employees. When I heard that description, I told my staff that day that this is extremely problematic, and I was extremely concerned about that because, in essence, when you looked at the numbers, Lisa, over 70% of the people in the city that are essential employees, they're black and brown people and poor people.
Right.
And we were basically telling them, and we need to really think about what we did. We were telling them, you are to go to your place of employment and continue to run this city. And you're going to do it with the full understanding that we're telling everyone else to shelter in place or hit pause, whatever terminology you want to use. And we're going to tell everyone else to participate in social distancing. But the 70% of you are going to do it without having PPEs, personal protection equipment, and you're not going to be able to shelter in place, and you're not going to be able to practice social distancing. So we put a body of New Yorkers in harm's way. And for the most part, their jobs were non-telecommuting jobs. They were the correction officers, right, the train operators, all of those jobs, full service places. So why are we surprised now when those folks would get infected with the virus, take it home to their family members, and the numbers are going to be extremely high? Then you overlay that with the fact that we were not testing in black and brown communities. The first state testing center was on Staten Island on the South Shore.
Right.
If you were African American and you wanted to be tested on Staten Island, you had to drive to the South Shore if you had a car. Brooklyn did not get a testing center from the state until last weekend. And so when you start to break this down, you realize that there was two responses to this virus. Then we knew at the beginning of this virus that those with pre-existing conditions such as diabetes, respiratory issues, etc., they are more likely to have a fatality over this. We knew from the Department of Health the stats on those with pre-existing conditions and what communities had pre-existing conditions. You didn't hear any briefing on a federal, state, or city level that anyone rolled out the pre-existing condition plan, because we had to fight this virus on two fronts.
Eric, I want to bring in Dr. Manny. Yeah, totally. And I just want to get Dr. Manny to weigh in on that because we've been talking about this from the first weekend we did the show. This is our third or fourth weekend of doing the show live. We had calls one day, one of the weekends, one of the Sundays. I was practically in tears, just hearing how afraid these people were. The essential workers were, because they didn't have protection. They had to go to work. It's like the first time we're asking civilians to go to a job when they know that they might be risking their life.
Correct. And it gets worse too. Imagine if you're watching TV or listening to the radio, right? And everyone is talking about COVID-19 and they say, well, those at risk are the elderly and people with comorbid conditions. But then there's no plan for you with a comorbid condition, right? So what do? Like just lock yourself in the house? And so people are terrified, right? So you have to put a plan in place for those at high risk.
What about what Eric is saying, the testing and the testing, which is such a key, and there doesn't seem to be a plan for those most at risk, aside from the doctors and the nurses, a plan for those most at risk or most exposed to
Correct.
get tested.
Even initially, yeah, to even add to that, remember when this the testing first became available, where you could have people that were exposed, one, and then you had celebrities and people with means could have access to tests, right?
Right.
Correct. And this was brought up even to the president. And he said, well, that's how life works. Right?
Right.
That's the
The
reality.
one that really got people was Harvey Weinstein. Eric, in terms of the testing and this testing plan, the mayor tells us that we're going to have 50,000 tests coming into New York City this week. But then there's supposedly the state testing line, and this is the biggest question that we've been getting from people is where can they get tested, who can get tested, and just the accessibility seems to just not be there.
Yeah, and it's so true. And first of all, if I could I want to thank the doctor, because I think about my days of policing. When we get these expertise in professions, it's not for our only personal good. It's for us to come back to our communities and really share some of these technical things to communities that they can understand it. And I heard them on before, and I appreciate you, doctor, for what you're doing, breaking it down so people can understand it. And so when you look at the testing, Lisa, think about it for a moment. The governor and the mayor must get on the same page. There's one coronavirus there's one COVID-19 that's attacking us. There needs to be one team that is fighting to stop it.
Right.
So we cannot allow ourselves to be caught up in disagreements at this time. Coronavirus must be fought on two fronts. We must fight the intervention, those who have it, and in a hospital, but we must also have the plan for prevention, prevent people from actually getting coronavirus. And one of the most powerful tools you can use is testing, particularly as Dr. Riley said at Downstate, all of our hospitals have identified what they call the hot zones or the hot spots. Those areas need to get on the ground, get the right testing, and make sure that we can get it done. I spoke with a representative from Health and Hospital every 2 weeks. I do a conference call with all of my hospital presidents in Brooklyn, and there was a rep on from Health and Hospital. What she was telling me, the Department of Health told them, don't do any testing unless you are going to be admitted to a hospital. They put out an actual ruling that if you're not going to be admitted to a hospital, don't test the person. While the state was opening testing locations in places other than Brooklyn now. Now, Queens, which is the epicenter of the epicenter, Brooklyn and Queens, they just got a testing center around 9 days ago.
Eric,
now, we almost...
Go ahead. I'm sorry. You're just pushing my button on, you're pushing my button on this. I'll tell you why, because we get this call all the time, which I understand. Everybody's trying to survive. They don't have time to look stuff up. Last week, my producer, Anaya, our production assistant, Juliana, they went through everything to try to put together a comprehensive list that we could post on our hot97.com website and also our social media, which reaches a lot of people. And this is what you need to do. Step 1, step 2, step 3. Because at first it was go to the hospitals and get a testing, but that wasn't true. And then it's call this 800 number. Then it was call 311. 311 is now overloaded. So people just don't know what to do. And we tried, they spent hours going through the different websites, calling the numbers, trying to put together something that made sense for people. If you're category A and you're fine, but you want to test, just chill for right now. Just stay home and take care of yourself and stay healthy. Category B, you've been exposed, you're an essential worker. We couldn't put together anything that I felt comfortable enough was going to be a reliable source of information for people. That's how confusing it is. And they spent hours on this.
And there was something, the Department of Health put out a ruling called Protocol 8. Many people in the city was not aware of Protocol 8. Protocol 8, now remember, we have two Department of Health. We have the State Department of Health, and we have the City Department of Health. The City Department of Health put out Protocol 8 that told all of our hospitals, you are not to test unless you are admitting the patients to the hospital. And so places like Brooklyn hospitals and other hospitals, if they weren't admitting someone to the hospitals, they couldn't do a test according to Protocol 8. Yet affluent New Yorkers and Americans were able to get their tests, and the state was doing something different in certain communities. Queens and Brooklyn was not one of those communities. Now, remember, the first death of COVID-19 happened in Brooklyn. The largest number of deaths is in Brooklyn and in Queens. And the largest proportion per capita, you had a significant number in the Bronx. All of these poorer communities were not getting the testing, so they won't take that virus home to their family members. And many of them were essential employees.
Right, with multiple, and some families with both, with both parents or with two members of the family on the front lines there.
Correct. And I think COVID-19 just exposes this on a bigger level. If we go back and we look at the numbers for how many people die with chronic illnesses, diabetes, heart failure, I bet you the same communities that people die the most, right? People are affected more in those communities. If you look at problems with access to care, same communities. Health literacy, same communities. So this is a much bigger issue where we need, and I really like the idea of, of us having this prevention kind of mindset and interception. And my whole philosophy and what I'm advocating for in healthcare overall, COVID-19 or without COVID-19 in our communities, is for us to have this idea of predicting disease. We know what the risk factors are for disease, prevention, and if we can prevent, we want to intercept the disease and then cure. That's the mindset that we need to have going forward.
And I think about this, Lisa. Isn't this deja vu? When I recovered from my diabetes, we talking blindness, permanent nerve damage. They told me I was going to, have amputation, be on medicine the rest of my life. I was going to lose my sight eventually. And once I started looking into the healthcare system and saw that we were not treating the underlying causes of our diseases, we were just treating the symptoms. We started doing things differently, and the Bellevue Project came about, lifestyle medicine. We don't have health care in this city and country. We have sick care. We prolong the sickness of people because it's a profitable business, and now it has come back and bit us in the ass. Diabetes is preventable and reversible with the right diet, but we don't have access to healthy foods in our community, so there was no real plan. We just put out a Feed New Yorkers report. The food we're feeding people in that Feed New Yorkers report is the food that cause chronic diseases, and it's the chronic diseases that leads to those who have the highest level of fatality. 94% of the people with pre-existing conditions were the ones that died from coronavirus. That's what we're dealing with. We're dealing with, as the doctor just pointed out, we're exposing the inequities in the healthcare system. There are two healthcare systems, one for the affluent and one for those who are middle and poorer economically, that have to go to the safety net hospitals where we're not getting the same level of care that we deserve.
And Erica, we got to move on to the phone lines because the phones are blowing up here, and I want to give people a chance also to talk directly with Dr. Manny, because we've had a lot of people just need some basic advice. What are you? Can you let everybody know what you're doing on behalf of the MTA workers? Because my heart goes out to them, especially those bus drivers. And there's been some attacks, some attacks on MTA workers. Since this started, and I don't know if they caught the guy that went after the worker with the golf club. I mean, just crazy stuff. But
it really is.
It really
and I've been
is.
meeting with the leadership of the union leadership of the MTA, the union leadership of the Child Protective Services agencies, the correction officers, all of these essential employees that were put out in harm's way. I have been having a conversation with them. And we're going to be taking some corrective action. But we've also been giving them masks and other protective equipment for the last 3 to 4 weeks. And they're in harm's way. And so all of our essential employees, the 9/11 operators, the school crossing guards, all of our essential employees, the supermarket employees, the post office employees, we have been giving them all the equipment that we could get our hands on. And we have donated thousands of items to hospital protective gear. So we're going to continue to do that. And this is only layer one, Lisa, trust me. But what's very important here, when you're in a mission of this capacity, you have the search and then you have the rescue part. The rescue part is when you can no longer find alive bodies. We're not at the rescue part. We're still at the search part. So we need to get right size what we're doing right now. Don't let people say, let's wait till the hearings and let's wait till the reports are done and say we could have done better. No, we could do better now and we could save lives now. We're still in the part of saving lives, not rescuing lives that were lost.
Absolutely. We're with you 100% on that, Eric. I want to thank you so much for being with us.
Okay.
We're definitely going to follow up with you on
Yes.
some of those things that you brought up in those issues. But keep up the great fight as always. It's always there's always something that's facing us, but it seems like we have an opportunity here to really turn things around.
Yes. Take care. Thank you.
All right,
both.
Eric
Thank you,
Adams.
Doc.
Thank you so much. That's Brooklyn Borough President Eric Adams. And Jack, I can take phone calls, right? Okay, we got Jack the Mac on the board here. All right, 1-800-223-9797. Dr. Manny, let's go to the phones right now. Let's go to Tiff. Tiff, hi, you're on Hot 97. Go right ahead.
Hi, I'm an essential worker. I'm an EMT, and I have a health concern with my job. Currently, they're letting people work who have tested positive, and it has been less than a week. And if they had 72 hours without symptoms, they're allowed to come back to work without even having another test to say that they're negative. So that concerns me because I have severe asthma. I have a child at home who has severe asthma. And I'm trying to keep myself as safe as possible. It has become less scary for me to deal with the COVID patients. Now I'm more afraid of contracting something from employees because now a lot of the employees where I work are getting the virus, and I believe it's becoming community spread.
All right, let's get Tiff. Let's have Dr. Manny address that. What would ideally, what you really should be getting done, and having done, and when. And then I'm going to put you on hold so Anaya can get your telephone number, and we can follow up with you. Okay?
Okay.
All right. Here's Dr. Manny.
Yes, we've had multiple calls around this exact same issue, right? Which means it's actually very real.
And
right?
MTA workers and EMTs.
Correct, and it's getting scarier. We know that the virus, people that have been infected and that recovered could still, be infected hours after, even days after they actually feel better. So you cannot, let people return to work without a test that is negative. You have to do a negative test, right? If anyone else,
Because there's no law about that right now.
of course,
but there should be a policy.
Could you imagine a big corporation having an employee that was positive and they felt better and then they returned to work without a negative test? Of course not.
Right.
Right? So I think that the least requirement to return people to work is to show that they had a negative test, because you need people that work with you to also feel comfortable. If anyone that you know, even at a grocery store, if you found out the grocery store coworker was positive for COVID-19 and then they show up and the customers knew this was the case, they will not be in there. Right, I've heard cases of places like Whole Foods actually testing their employees for this. So people should be tested. You cannot let people return to work without testing them because you keep people worried, especially when you have people that have comorbid conditions like asthma, right? So the caller is saying, I have asthma, so you're high risk, and then you want them to put themselves at risk. People are not disposable here. It's very important for us to take care of this.
So, and 72 hours is not enough, right?
No, it's not. We've seen reports of this actually lasting up to 8 days after people that have recovered are still infected days after they actually recovered, right? And we're still getting to know this better. But at the same time, if we know it's 72 hours still, let's say there's a policy that says 72 hours. The least you could do is test those people after 72 hours to make sure they're negative before they get back into the workforce.
Exactly. Jack, can you put Tiff on hold? Can I take another call while I'm doing that? Okay. I just don't want to disconnect people, and Anaya's going to get her number. Okay, Dr. Manny, let's go to Nancy right now. A lot of questions on testing. Nancy, hi, you're on Hot 97. Go right ahead.
Hey, Lisa. Hi, Dr. Manny.
Hello.
Listen, hi. I'm still not tested. I called in a few weeks ago, and, whatever, but I think people need to wait 3 weeks because that's the average time a virus takes to go through your body. Dr. Manny, do you agree?
But to go to
Wait,
your body.
Nancy, say it again. In terms of after you test positive, you're saying, or what? Just refresh us with the case.
From the day from the day that you test positive, give it 3 weeks, people. You know what I'm saying? Like, I understand we all have jobs to work at, we all have money to make, we all have kids to take care of. But an average virus, once it enters your system, it takes 3 weeks for it to exit your system through, guess what? PP and poo-poo.
No, correct.
You know what I mean?
Yeah. No, I agree with you. I think once you get infected, you want to give it. So first, if you look at incubation period for this, right? It goes up to 14 days for incubation, right? From the time you get infected to have symptoms.
But you don't really know when you get infected.
Correct. You don't know. So it doesn't matter what point you get a test, right? So if we give it 14 days incubation period, and let's say you had no symptoms, or you're positive, you had symptoms, and you recovered. We know that even after that, it's still possible you may infect other people, right? So you might be a symptomatic carrier, but you don't have symptoms anymore because you control the symptoms, right? Which is what we do when you go to the hospital today, because we know there's no cure. So what we're doing is managing the symptoms. So what happens is if you end up at that point when you're still infected and you return back to work, you're getting other people sick. There's no reason to be rushing right now, right? So even if you make the money now, you don't have to pay bills right now. You just be patient. We'll get back to normal. There's no need to rush this back in because we could get another spike and we could be in more severe lockdown going forward.
On a more severe lockdown, exactly.
Correct. So it is very important for us to be patient. Just stay home, relax. It's hard on everyone. We completely understand that. It's very hard.
Right.
But that's what we need to do to get back to normal.
All right. Let's 1-800-223-9797. Dr. Manny with us on Street Soldiers this morning. We are live here at Hot 97, right from the epicenter of the coronavirus pandemic in the United States. Let's go to Gina right now. Gina, hi, you're on Hot 97. Go right ahead.
Good morning, Lisa. Good morning, doctor. So my question is this. I'm an essential worker. I work for a vertical farm, and we're hiring new people. So eventually, within a week or two, they're supposed to be testing us. And my concern is, okay, I can get tested today and it's negative. But we're hiring these new people. We don't know where everybody else has been. How do I know that I'm still going to be negative in weeks to follow? So should I still be trying to get a test like every other week? Or, like, I'm very anxious about all of this. So how do I know, like, one test is okay?
That's a great question.
Should we getting tested numerous times?
Gina, let's get an answer from Dr. Manny. That's a great question because a lot of companies too, you have a lot of new people coming in, so you don't know what their usual, you just don't know what their usual mode is or health level is.
No, but the question is actually very legit, right? So what we talked about, if you look at the testing, it's in several forms. So the current test that's available is an antigen test, right? So you're looking for the virus, which means that literally you could be in a car and you test. So let's say you test negative this morning, and then you get in the car, hit the elevator button, you get infected with the virus, you touch your nose,
right?
Right? That could happen in real time, right? So can you do continuous testing every single day? That's probably the way to look at this is you should do it as you do diabetes testing, right? If that was a reality, if we had enough tests, like of course you have to test on a daily basis to find out exactly where you are, where you stand. Until we have this antibody testing, right? So antibody testing will help us better because with antibody testing, you've been exposed and if you responded to it, and you could track that over time. So it's much better than what we have today. But for what we have today, this is repeat testing. You need to continue testing.
So for Gina, what should she be? She should be trying to get tested if she can, like what, every week or every 2 weeks, or only when she feels symptoms?
No. So the reality of this is right now is what we all are in the same scenario, right? Even if we get back into the idea of traveling or going to concerts or movie theaters, we'll be in the exact same situation, right? So everyone does a test, then you're negative. It doesn't mean that someone breaks into that circle of trust,
exactly.
Correct? So if people are being tested before they join, the hope for they join the workforce or where she works, the hope is that if they're negative, then that means they're not exposing anyone at work. But let's not forget that those same people then travel back home, and people might get infected the next day, right? And so
really the best thing is you have to be super clean, protect yourself as much as possible, and stay healthy. That's until there's a vaccine. That's the long and the short of it, right?
Yes, that is the reality of it. In the real world, in the perfect world, we should have testing for every single person at any given time. That's what should happen. But that's not the world that we live in today. We don't have enough tests available for people. As a matter of fact, even yesterday, there was a report from CNN and Forbes about the CDC. The first batch of tests that were sent out were all fault. Majority of them were not actually working from the CDC's lab.
So, but when you say that, and that's true, that was widely reported. That people don't have confidence in what they're hearing anyway, because the CDC, the same ones that said, well, first you don't have to wear masks. Now
Correct.
now we have to wear masks. By the way, in New York State, everybody should know this.
Not only should you not wear a mask, but they were proactively telling people not to buy masks.
They were telling people don't wear it.
Yeah, correct.
So it's like, wait a minute. I mean, and then now this batch of testing that they did, you said was compromised?
Correct. Yes, they had errors in the CDC's lab. So a lot of those tests were not accurate. So it delayed results for a lot of people that were probably sick. Some people probably died. Some people probably had false positives, false negatives, right? So this happened. And so people don't trust the test anymore, right? A lot of tests that were sent by the CDC to states to use then have no use, right? So that's the problem, right? People don't trust the system. So it's very important for communication to be very, focused and actually in one direction. And if they make errors, it's okay. We could learn, but make sure we communicate that to people to understand why.
All right, let's go to Antonio right now. We're taking your telephone calls, 1-800-223-9797. That's 1-800-223-9797. I'm Lisa Evers. This is Street Soldiers. Dr. Manny with us in studio, answering your questions about health and testing and all things related to coronavirus. Antonio, thanks for calling. How are you doing? Antonio? Antonio, hi, you're on the air. Go right ahead. Okay, well, I guess not. All right, let's go to Beverly right now. Beverly, hi, you're on Hot 97. Go right ahead. Beverly? Am I not doing
Hello?
Hi, Beverly, you're on the air. Go right ahead. This is Lisa Evers.
Yes, I'm calling because I have a concern. I work for a hospital, and I just wanted to know, like, when people are testing positive, they are saying, as per the CDC, you have to be out a week and then no symptoms for 3 days. But I don't understand that. I think that's what's making the employees go back to work, because they're in fear that now you're not going to get paid, and you're getting cleared by the occupational health services, because they're saying, you have no symptoms or you tested positive, but you're good because you were out a week. But they're saying this virus lives on your body for 14 days. And even people that have passed away, they said the virus lives on their body after 15 days. So I don't understand.
Beverly, I'm glad you're asking this question, because are you at Jacoby by any chance? You work at Jacoby?
No, I work in a different hospital.
A different hospital,
Correct.
okay. But the Dr. Manny, this was an issue for some of the hospital workers. Actually did a protest about it at Jacoby last week. They were only being given a week if they tested positive for COVID-19, and then they had to come back to the hospital because of the heavy patient load. What can you tell Beverly about this?
Correct. So in a perfect world, right, we will wait till people recover and then people return to work. That's why we fight for this reason. We fight for the idea that frontline workers should have access to protective equipment, right? Because people are getting sick. If people get sick and they call out, then people that show up at the hospital, we have no one to take care of them.
But then when they are sick, she's saying instead of getting the 14 days you're supposed to have after you test positive, they're only getting 7 days, and then they're putting them back into the hospital.
Correct.
Does that make sense?
It doesn't make sense, but they're short on staffing, right? So if they put people 14 days out, then who else is going to cover those shifts? Because remember, the same reasons we have shortage in PPEs is the same reason we have shortage in staffing, right? They don't have enough staff to actually cover things, right? I mean, I know right now they're hiring nurses out of state to move to New York City to help with, and people that are retired are coming back into the workforce.
Right, and Scott Stringer told us about Assemblywoman Reyes from the Bronx. She was a nurse before she got into public office, and then she went back to being a nurse because she had to help out.
Correct. And so there's a shortage of this. And many clinicians are doing this. People that are retired, even going back into the workforce, right? So are we doing the right thing in that sense? No, it's actually putting more people at risk.
What should Beverly do? Obviously, talk to the nursing association if she's in the nurses union.
Correct. I think you're already doing a great thing by bringing it up, on the radio,
Publicly, absolutely.
for people to know about it, right? To say, hey, you should be ashamed of this, right? You should let people actually recover fully. We should, because you're reinfecting people and putting people at higher risk if outbreak was there.
Beverly, does that help a little bit?
Yes, it does. It does, but I'm still, concerned on, saying a person could go back to work, with a mask. And I understand they're short of healthcare workers and saying that, social distance. But in the reality, in the hospital, there's no social distance.
Exactly.
There's no way.
There's no way. By definition, you're right there, hands on with the patient, especially the nurses, because you guys spend so much time with them. And thank you so much for what you and your colleagues are doing too, because the nurses are there. No disrespect to the doctors, Dr. Manny, but the nurses are right there on the front. You're there with the patients for much longer periods of time, I think.
Nurses are my
Yes.
heroes. I say that all the time.
Well, thank you.
All
for
right,
answering
Beverly.
my
Hey, Beverly,
question.
hang in. The bottom line is, you know what? You know when you've had too much with you have to take care of your health first. That's
Correct.
number one.
Right. Exactly.
That is number one. You got to take care of yourself. So thank you so much for the call. We appreciate it, and thank you for the work that you and the other nurses are doing for us.
Thank you. Have a good day.
All right, take care. Thank you so much. Isn't that a shame?
It's extremely shameful that that's what is happening.
I'm
and
embarrassed as an American.
I think that's is great, having a show, Lisa, and having people to call in that you talk about these things. Otherwise, we will never hear about these things,
Right.
right? Because these are not things that are covered in the national media.
No,
yeah,
and-
but these
right.
are realities of things that people face on a day-to-day basis.
And these work conditions. That's what Brooklyn Borough President Eric Adams was talking about. These work conditions for essential workers and these frontline workers just being treated as if they're disposable, and they're not.
No, they're not. And it's very important because if people are getting sick and people are worried about their own communities, then they don't want to come to work, then we'll be in an actual worse situation than where we are today.
Do you think we'll see something coming out of this, like a health? Like we have the National Guard, which are citizen soldiers. They're called up. We'll have like some type of health guard where there's volunteers that are called up, or from other from academia or from other states or whatever. So it's more organized in the future.
For COVID-19 or for...
No, for just any pandemic, they get activated and to the hot spots.
Correct. So I strongly believe that in healthcare in general, for the future healthcare, I'm a health futurist, so
Right.
so I think I write about these things all the time. And the mission here is going forward. All of us will be more proactive about healthcare. Eric Adams earlier today talked about the lifestyle medicine kind of approach, right? If we make it a lifestyle thing in our communities,
Right.
then we're always ready for what's going to happen, right? Because even if a pandemic shows up down the road, we have less diabetes, less heart failure, less asthma conditions, and if we do have those conditions, then we know how to better manage it.
And we are seeing a little bit of it with in hip hop. We did our hip hop health revolution, and Styles P with the green juices, and just a whole different lifestyle from what he used to have, espousing for a lot with health with his amazing wife Adjua. So
Correct,
it's
and
happening.
work with community leaders as well to have these
Yeah.
community gardens, right?
And
to
Eric too,
educate,
right.
the younger people how to actually grow these foods, right? How do you grow carrots and how do you grow tomatoes? Like it's real.
All right, let's try to take a call here. Is this Mula?
Yes. How you doing? Good morning, Lisa.
Good morning.
Good
How
morning,
are you?
Doctor.
How are you doing, Mula?
I'm okay. I mean, I'm dealing with it. But my thing is, first of all, I'm a maintenance worker for the New York City Housing Authority in the Brooklyn area, right?
Okay. Oh,
and
wow.
I just strongly feel like, NYCHA is being left out of the equation. Not to take away from all the other essential services, but we work around hundreds of people every day. We in and out of these apartments. The caretakers, they take care of the developments, they clean the buildings, and I just feel like the union is non-exempt. Like they're not involved pretty much, and it's frustrating because, as we all know, that there's a lot of things that's swept under the rug. There's
Right.
hundreds of people dying and getting sick within NYCHA, from the residents to the staff. So it's just a little, my anxiety, the PTSD of it all. It's just nerve-wracking and frustrating. And it's like, what do you do? What are you supposed to do? What do you do in a situation if you a maintenance worker or a caretaker, a maintenance worker being that he has to go into the apartment to make these repairs because, believe it or not, there are emergency services from floods, leaks, to just everything that we do inside the apartment. And these are hundreds of people inside of these developments. You understand what I'm saying?
No, Mula, I've done a lot of reporting on NYCHA, and over the years, and especially the last couple of years. And what was, in fact, I did a story for Fox 5 News this past week about NYCHA in terms of the issues facing residents, but also the issues facing workers, because you do. I mean, when you have to do emergency repairs, you have to go into the apartment. There can be, and a lot of times there's families there, and sometimes they're doubled up, and you have to go in there. Are you given masks and gloves every day while you do this?
Which leads me to my next thing. It was a memo that came down saying that you're only supposed to have 1 mask per day and 2 pairs of gloves to last you the whole day. And it's like, you got to be kidding me. 2 pair of gloves is not even a stoppage. Say we go into an apartment and we got a clear stoppage, tub is filled with dirty water or whatever the case may be. That's not even enough for one job, yet they want you to do numerous amounts of jobs. It's like I really feel like NYCHA is being left out of the equation. not to take away from, the MTA and things like that, but I did not hear the borough president mention the New York City Housing Authority. And then as far as like when we contact the union, the union, they working from home. You understand what I'm saying?
No, exactly. And which union? What union represents you guys?
Local 237.
Local 237. All right, I'm going to say this right now on the air. Local 237. If anybody wants to come on and talk with us about what you're doing for your workers that maybe we're not aware of, or maybe we're not seeing, or maybe the shipment of gloves and masks didn't arrive yet. We want to hear from you. You can hit us up, street soldiers at hot97.com, or you can call in right now, and I will take your number. We'll talk off the air if you want first at 1-800-223-9797. And Mullah, I don't think people understand. I've been in many apartments these last 2 years. When there's a leak, it is super nasty. When those toilets start erupting, that is disgusting, and you guys have to go in there and help those residents manage it. And I can't imagine doing that with no matter how you wash the gloves after that.
It's breakfast time, Lisa.
I know. I'm sorry. No, I'm just saying. What he's saying is real. It isn't like come on in here and change a light bulb. It's like these are
right.
pipes. I'm sorry about that.
But if you look
I don't mean to gross people out, but it's like
but it's a reality.
I've seen it. I mean, I've seen it with my own eyes. So
Correct.
it's not. And these burst pipes and these water all over the hallway and.
But how much is a glove? I mean, let's we talk about
right.
NYCHA gloves here, right?
Right.
So how much it costs to make one glove? And you want someone to go into a job that is paying hundreds of dollars, and you are literally giving out 2 pairs of gloves.
Exactly.
We're talking about gloves here, right? This should be everywhere. We talked about this before. I don't think people should actually be going out to go buy gloves or face masks.
No.
We should have them everywhere that people are forced to use them.
Let's go to Ed right now. Ed, hi, you're on Hot 97. Go right ahead.
How's it going? Good morning, everybody.
Good morning.
I have a question. I'm a building superintendent. And although we are not in the hospitals, we are in the homes and buildings where most of the patients are originally coming from. That building has thousands of apartments. We just got masked on Thursday. Although we had gloves and stuff like that, have my staff, they're working, with cleaning the building and detailing and everything. How do we know that we're doing it properly? How do we know we're not taking this back home with us to our family? I literally been working for 3 weeks, 7 days a week. More than half of my staff is out. So I'm here. I don't want to come out of my office, but my staff is out here doing what they do. How do we know we're not taking this stuff back home?
Dr. Manny, what about that?
Yes, so I think if you go into a building, you should definitely, we know that a lot of people that are actually infected are not in the hospital, right? They're home, right? If you look at the number of cases that we have, significant number of cases, and there are many people that are even carriers that don't even know because they don't have symptoms yet, right? And so going into any building, especially if you're going door to door, you're definitely a higher risk of being exposed to this virus. So the best way to protect yourself is to look at every single situation that you're in as a possible means of getting contaminated. So you want to put on your gloves, definitely. Right? You want to put on your protective mask. You should have had mask a long time ago, right? But at least for now, make sure you go and put on a mask. Even having those full body clothing. It's actually very interesting if you look at other countries, even China, for example, right? And you see people go out to clean. They're fully
equipped.
They
have those full hazmat.
Correct. They have the full hazmat suit.
What we would call the space
Correct.
suit.
And then you go in and then you get rid of them and you dispose of them when you get into any single place, right? Not going from door to door with the same outfit. But we should be flooded with PPEs. It should not be something where we have shortage or having one person with PPEs. It should be something that the market, we talked about this, right? rappers, actors,
NBA players
are able to buy this thing out of China, right? They could get hundreds
Right.
of thousands of this. I mean, I
Right.
have friends right now that are trying to sell stuff on the site, and they have tons of this. But yet, the government is telling us they don't have access to this.
Right, the owner of the New England Patriots flew his own plane to China.
That's what I'm saying. And then picking these things up, right?
Right.
And so if you think about it, it's not like these are designer items, right? So
Right.
it's not like
It's
$100,000.
gotta be handmade by 200
Correct. It's not like
workers, right.
$5,000 sneakers. These are disposable paper stuff that you
Right.
could buy tons of them so people could put on and dispose of. So that's something that we need to advocate for and push for because the lives of essential workers matters.
Exactly. All right, let's take a telephone call. Let's go to, here's an interesting one. Okay, Joseph, hi, you're on Hot 97. Go right ahead.
Hi, good morning. Good morning, Lisa. Good morning, Dr. Manny. How y'all doing?
All right, how are you doing?
Good as well. I have a quick question. Obviously, we're all supposed to be wearing our PPEs daily since it's the law now. Obviously, I wore gloves, plastic, the gloves plenty of times, but now as I'm wearing them, constantly daily, I'm starting to get swollen and have almost like an allergic reaction to it. So what can I use to treat the dryness and the swelling in my hands because I'm constantly wearing these gloves?
Are you using latex
It's
gloves?
non-powder. It's non-powder. It's a non-powder joint.
Is it latex or nitrile?
Yes. It's latex. It's the synthetic vinyl powder-free joints.
Yes, I have this exact same kind of issue when I wear gloves. Like sometimes it gets sweaty and right. I mean, it's not your body.
Well,
reacts to it.
everybody, right?
Yeah, correct. So it's not like the most.
But some people are their skin is more sensitive to it.
Yeah, correct. So
Right. But I'm saying not sweaty, but after the fact. After I wear the gloves, I dispose them. When I come into my residence, I dispose them. I wash my hands immediately, but then afterwards I get a dryness, and then sometimes I get a swelling, and that's from the gloves. I already know that.
Yeah,
So.
because the
Are
gloves
they too
are
tight?
squeezed. Yeah, they're too tight. So
No, not at all. No, I get a size bigger than the size of my hand.
Do you put any lotion on your hands after you wash them? No, I'm serious because
true,
I know
yeah.
guys don't do it the way we do it, the way women do.
I don't.
The
I don't.
lotion-
That's what I'm saying. No, I don't.
You should
They're
put
not
some
saying
lotion
that.
on
That's what I'm
it.
saying. They're not saying that.
I'm
They just say
I'm saying-
wash your
I'm
hands
saying
and then
put-
put some alcohol on it.
No, your hands are probably all dried out. That's probably what one of the issues
Okay.
is.
Okay.
Lisa got a bunch
feel
of
you.
lotion. I guess you could.
I do. I have.
Is it Lisa brand?
I have a lot of different lotions, but Joseph, try just try it because it sounds like you're doing everything right. This is something
Right.
we're going to have to deal with. I mean, I'm not a health expert, but I do it. I have,
Right.
But my hands were starting to look like lobster claws between the sanitizer
Exactly. There
and the
you go,
washing.
Lisa. Exactly.
And the whole, No, I'm
Exactly.
serious. I want to wear the gloves now because I have the nail salon hasn't been open for a month, and my hands are looking like
Word.
lobster claws. It's like I'm hiding them. When I have to hold that Fox 5 microphone, I tell the cameraman, I'm like, don't have my hands in the shot. Cut me up on the.
Right.
No,
Right.
so,
I feel you.
I'm
feel
just
you.
trying to make us laugh because it's annoying, but it's a necessity. I would just get one of those kind of lotions, like the Gold Bond lotions are really good for men. They're very strong. Just get a tube for a couple dollars. You can get it in the in any of the drugstores. And
Yeah, like the Rite Aid.
Yeah, like a Rite Aid or whatever. And then I would just right after you wash it, dry them really, really well. That's a key.
Right.
And then
Right.
put the lotion on. And those Gold Bond ones go in. They that's the one I've been using. That's
the best one, right?
They sink it. Yeah, I think so for the hands because like I said, and even before this, because I'm out in the streets so much, and I'm talking to people.
Right,
and
yeah,
shaking
right.
a lot
I
of
can just
hands,
imagine. Yeah, you
wash
out
my
daily
hands
too.
all the time. So the
Right.
other lotions get greasy or they have too much of a scent.
Right,
can
right.
just
Yeah, I don't want that.
You don't want to, that's an issue for guys especially. So it's like the just the Gold Bond ones. They have like a whole line of them. They have little tubes. They have bigger, like a bigger pump thing you can keep right on your sink, in your bathroom or your kitchen,
Right.
wherever you wash your hands when you come in the house. Just dry them. Put the Gold Bond on. If you start doing it I started doing it for, religiously, and it's really made a difference. So
Okay.
I'm constantly sanitizing, washing, gloves on, gloves off, and
Right.
a lot of washing because there's just at points like
Right,
one-
yeah, that
you're in
too,
one
yeah.
place. So try that, and I would highly recommend it because it sinks in, but it won't be greasy and you won't feel gross or smell funny.
Okay. I
Okay.
appreciate that. I
All right.
appreciate it. And I also want to say thank you for keeping it honest and always giving us the exact information throughout the metropolitan area. So I thank you, Lisa, and thank you, Dr. Manny, for for keeping it real with us.
All right. Well,
Thank you.
thank you so much. I really appreciate it. Thank you.
Thank you.
All
Have a
right,
great
Joseph.
weekend.
Take care. Okay.
Bye bye.
All right. Let's go. Let's see if we have him right now. Rule, are you there?
Hey, it was Lisa. What's going on? How you feeling?
All right. How are you feeling?
I'm great right now. I'm up in my office. I'm working, so all good.
I see that now. Now, normally you would be about to get on a plane from someplace you performed at the night before, and we would never.
Yeah, right.
It's a whole different thing now, right?
Yeah, no. Actually, it's a Sunday, so I'll probably be headed home today. On Sundays I try to make it home to the family, and do the Sunday family thing. So
Which is a great thing. That's why I stayed married for 19 years.
yeah, right.
So yeah,
Sheesh.
congratulations.
That's like 100 years in hip hop, right? It's like dog years.
Congratulations to you and your wife. She's always been by your side, and we love her.
That's
We
my
love
rock.
her.
That's
Yeah.
my rock. I appreciate it. I'll let her know, Lisa. I'll tell her.
Yeah, tell her. No, we love it. But Ja Rule, everyone knows you, of course, hip hop star, businessman, philanthropist, and you were with us. We were talking. The caller that we had, the end of the last hour, was a NYCHA worker, which you've been with us on the fight with NYCHA for the last couple of years as well. But you've been doing some things, and the reason I wanted to talk with you now was because this coronavirus thing is really hitting our communities very, very hard, and you've been doing some great stuff. So I wanted you to just tell people about what you've been doing and how you got involved in it.
Well, my guy David Prince that works with me with my company Icon, he approached me about doing something with not give a sock and giving away some of my masks to the homeless. And I thought that was an amazing, thing, an angle to take, because everybody's been doing what they can. And, everything's been kind of geared at the essential workers and stuff, which they need the most. Don't get me wrong, but the ones that get forgotten about a lot, often, almost all the time, are the homeless. And
Right.
they don't have a home to go to and stay home and quarantine and shelter in place and all this stuff. So, I thought that was a great thing. So I donated 2,000 of my masks, over 2,000 masks to not give a sock and the homeless shelters here in New York City. And then I seen something on Instagram, and a friend of mine, Scott LaRock Jr. I know you know Scott.
Yep.
Scott
Shout out
LaRock
to
Jr.
Scott.
He hit me up. Yeah, he hit me up and was talking about the hospital right here in Lincoln Hospital in the Bronx. And they were picketing and protesting, about not having the right equipment to work. And I was like, this is a disaster. If we lose the people who we need the most to save us, to help us, this thing could spiral out of control very, very fast. So Scott hit me up about donating some of my masks to them. So I was like, yeah, man, sure, of course. And so I took another 1,000 out to them. And now the funny thing about that is that after I did that, my mom seen it. She seen it on my Instagram feed, and she hit me. She's like, boy, I was born in that hospital. That's my hospital, Lincoln Hospital. I said, get out of here, Mom.
Did she really? Shout out to Mom's Rule.
Yeah, shout out to Ma Dukes, man.
Ma
Lincoln
Dukes, shout out to
Hospital,
Ma
man.
Dukes.
No, but thanks for all the great work you're doing.
This is Dr. Manny here, Rule. You like him?
And
hey, Dr. Manny, what's up, man?
I've been a big fan. I went to medical school listening to your music. So.
Hey, there we go. I'm glad I can help some of the docs through the time,
Yeah, I did. Actually, I got a buddy of mine actually in England right now. He says, hey, you're on with Ja Rule. Tell him I was a screaming fan in his Manchester concert in Manchester, UK. in the 2000s.
Yeah.
That's crazy.
But that's good. How do you get access to all these gloves and the government can't? Which is a great question.
Yeah, Rule.
Right?
Excellent question, Dr. Manny. Rule, what about that?
I made them. I started making masks. I got with a company and made some masks, and I sell some as well. I have some stylish masks that I made for my company that I wanted to, help promote the company, and stuff. So, in the process of that, I said, man, we're going to donate, a gang of masks. For every mask sold, we donate another mask, So, we've been doing that, and I've donated way more masks than I've sold.
Correct, and I think that's actually a big business going forward, actually, because everyone is going to have a mask.
Right, and you're gonna
It's
get
sad,
tired.
but it's true, Dr. Manny.
It
It's
is
so sad, but it's true, man. People are gonna want to, wear something a little more stylish, though, and not be stuck to the regular, white mask. So I tried to give them a little something. See what I'm saying? Look,
That's right.
we got the swag together.
He got
swag together.
He got the camo. He's got the street soldier. He got the camo for
We need
street soldiers.
designer ones, though. We need some from him.
What do you think this? Wait, Rule. So, are you predicting? You think this is going to be like like sneakers? Like you can't just have one pair of sneakers. You got to have different sneakers for different occasions and moods.
Of course, you're gonna want different masks. Like, listen, if I'm wearing all black, I don't want to wear a green mask. You know what I'm saying?
Right.
So I think people are gonna, put a little style to it. I mean, it's just how we are as people, man. We're not gonna let nothing get us down too long. We're gonna jazz it up a little bit. Shit, we made chitlins a delicatessen, a delicacy.
So you think it's going to be like the hip hop swag where you got to have your fitted match your t-shirt, match your sneakers. There's going to be like a whole thing now. The mask is going to be a big part of it.
Actually, I pray it does not get to that. I pray we can go back to being who we are and we're seeing each other's beautiful faces and smiles and stuff. I like that a lot better than wearing masks and covering up and social distancing. I'm a people person, so I want to get back to that. I want to get back to giving hugs and high fives,
Back in the day, Michael Jackson used to put on the mask, right? And
he was ahead of his time, man.
That's what I'm
we
saying.
always knew he was ahead of his time.
That's right.
in a lot of ways. But Rule, when you look at how much things have changed right now, because even I was just I sent Dr. Manny the NYCHA town hall that we did, that first one with you in January 2018, and it's just you were so great to come out there because a lot of people weren't speaking out then, and to support the residents. And also to, you stayed for so long afterwards, everyone putting their arms around you, taking selfies. And it's just like, we can't do that right now. We can't be like with the people like that,
That. It's so crazy because I actually think I had COVID. And this is crazy because when I came home from Super Bowl in February, I was sick. Like, I mean, super sick. I had 102 fever. It was the sickest I've ever been. So I went to I thought it was just a regular cold, maybe starting to catch a pneumonia or something on the verge of that or whatever. So I went to the doctor once I got home, but I was getting better. My symptoms were starting to pass. And then I went to the doctor anyway because a friend of mine called me and said, listen, you should go because I went to the doctor and I was diagnosed with the flu and bronchitis. So I said, all right, you know what, let me go because I was around him and he was coughing all over the place. I said, let me go. So I went and they diagnosed me with bronchitis and gave me an asthma pump. Now, I ain't never had no goddamn asthma pump. They gave me steroids, antibiotics, and they gave me the asthma pump thing, which I think was a Buterol in the asthma pump.
Correct.
So I've never had any of these things. So now I take them, I use them or whatever. I got better, but it was the worst time. It was the worst I've ever been. And then the whole, COVID news comes out, weeks later that it's running rampant through the country. And I'm like, damn, I may have had it and not even realized it. A lot of people got sick at Super Bowl.
You know what? Can I tell you something? You're the third or fourth person that has told me that from Super Bowl weekend. They had like a severe, like exactly what you were saying.
Yeah, this was around in November, December, January, and no one knew about this, right? And so there are many people that died from this in January, and they think they died from something else, right? That was COVID-19. The numbers of people infected, as we go back and look at the medical records, those numbers are spiking because a lot of people had this and had absolutely no idea that they had it. But it looks like you're in good shape. So so that's probably why you made it, right? I mean, I had friends that I know who have been sick, and then by the time they took the test and went home, they actually felt better before the results came back.
Wow, that's
because it takes like 5 days to get the results. I have
Correct.
some cases like that too. Some friends that went through that. Yeah.
Correct.
Wow. So, Rule, in terms of the reaction that you've been getting from people, and because for entertainers like yourself, for artists like yourself, you do a tremendous amount of touring every year. You're like
Yeah,
all over the world, and
yeah.
it's like, how has this, like, what do you think this is going to do to just the way, the way we listen to music, our artists? What is it? First of all, there's a lot of artists and DJs and entertainers, concerned about the bottom line. What's going to be happening.
Yeah. I have somewhat of a solution I think could work for entertainers. Um It'll work even a little better than the solution I think that's being put forward for sports. Playing sports without the crowd is
Not the same, right?
it's difficult. It's difficult to watch. It's probably not hard for the players, but it's difficult to watch. It's like you see.
Exactly.
What he's saying is,
I don't know.
He
I
got,
think they
he
can
got a
work that out,
business.
too.
He got a business angle here.
Yeah.
But
He's a businessman. Come on.
But I think with entertainers, like, let's say I go and I rent out, I don't know, a Paramount Theater for the night, and I say I'm going to put on a concert. Now I can probably do that with 5, 6 to 10 people, without a
Right.
crowd.
Right.
Film it virtually and put it out to the world. So now everybody can see my concert, millions of people. But you'd have to pay for it now. Don't get me wrong now. This is not a freebie here. You'd have to pay for it, but the prices could be much lower than you would pay for a regular concert
Right.
because now it's so broad, everybody can watch. And you can give the people a really good show because you're in the venue. You know what I'm
Because
saying?
you're like
Now
on
I
a
can
real
have my
stage, right?
dances.
It's not like it's not like you're living. You're
I'm
doing it in your
not in my
living room.
living room trying to fucking play the banjo. You know what I'm saying?
All right, just watch the language. Just watch
right.
the language. We're on the
I'm
FCC.
sorry,
Sorry,
I
baby.
forgot yeah.
I know we
So,
feel like we're talking, and we are, but we're
Yeah,
on the
you know
radio.
how- you know how that goes.
FCC's listening here. Okay.
My
sir.
bad,
No,
kiddies.
it's all right.
Uncle Rule, sorry.
These things happen. But anyway, so you're saying that might be some way that the entertainers and that could be like a whole new thing.
I think that's something that we'd have to look into going forward, because one, the venue gets to get rented out, so they get to make money. Some people will make some money because they got to work the venue, they got to work the lights, they got to work the, So, but through all of that, you can basically social distance. The light guy's way over there, the sound guy's way over here.
Right.
It's like we're way away from each other, and then I'm on the stage. I got my DJ and my dancers or whatever's going on, and I think you can be pretty much as safe as it gets. So you have your band and your dance or whatever. You can be as safe as you can get, and I think we could try something like that until we get back to crowds.
But how does it feel though, Jared? I mean, how does it feel
before-
being if you're performing by yourself in the crowd?
Yeah, without the
Don't
crowd
you get
energy.
from
Yeah.
the crowd? Can you
I
make it
get
a
energy
two-way?
when I talk to
You really do. You
do,
feed
right?
off the crowd. You want them there. You want them there to sing along the songs with you. So I get it, man. Maybe someone can build something that works a little better and helps.
No,
you know what show people want to see right now. You know what people want to see right now, because these IG battles are going.
I love the IG battles, man. I
tell
feel
us
bad for Teddy last night. Everybody's hitting Teddy with the memes, man. Hey, people, these things happen. Technical difficulties happen, man.
Okay, but
and
listen.
you know what's crazy? Teddy actually tried to give us the best sound possible by having that elaborate setup.
Right.
And it kind of backfired on him, but yeah.
It sort of did, but in terms of the IG battles, the social media has been buzzing about you battling 50 Cent. What about that?
I never back down from a battle, man. I love it, and my catalog speaks for itself. I have a great catalog, and it'll be dope for hip hop. It'll be fun, and it's for the culture. And it's, Versus is about love and respect for each other's catalogs and what you've done for music and what you've put, what you've contributed. So, I don't know if me and him could do that, because we just don't. Yeah, we're oil and water, So I don't know if that'll work. And to just for respect of the culture, I would never want to disrespect the culture and let me and his little thing get into the love and respect of what Versus has brought to the culture for each other's, for artist catalogs and the artistry. I would never want to, tarnish that or mess that up.
You're like really on the high road this morning here. This is like church almost.
It's Sunday, Lisa.
It's Sunday. Listen, so is there anybody you would battle in a fun way without it being like a steel cage match with 50?
I'd battle anybody. Like I'd battle him too if he knew how to act civil and be a grown up. You know what I mean? But we all know that that's not reality. And the reality is, with him, you got to talk dirty to him. There's no, you know what I'm saying? It's just no. So that's what I mean. I wouldn't disrespect Versus like that. And Tim and Swiss, they don't want that. They want this to be what it is
about the culture,
love,
right?
About the culture and what what this music has meant to people over the years. You know what I mean? And my music definitely brings a good vibe. People remember barbecues and birthdays and stuff like that, and weddings. People getting married to put it on me right now. So. That's what my music represents. It represents a really fun, loving time in hip hop, a good time in hip hop.
All right, well, let me ask you to give a shout out, and then how about taking some phone calls, because we have a lot of people here that would like to they got questions for Dr. Manny. Maybe you can just give them some support, some moral support. But
man, I got questions for Dr. Manny.
Go ahead.
I got a big one for Dr. Manny. Hold on, I got to ask Dr. Manny this. So. Is there any chance, Dr. Manny? Because I got a conspiracy theory here.
Oh, here we go. Okay.
Is there? No, I do. Is there any chance that this coronavirus, this COVID-19 disease, virus, whatever you want to call it, could be like some sort of mistake that happened in a lab somewhere in Wuhan?
Actually, it's not a conspiracy theory.
There's substantial evidence from the State Department transcripts.
Yes, there's actually evidence supporting this, and it's highly likely, that this came out of a lab. That someone.
The Wuhan province is known. That lab is known for developing biochemical warfare agents. Correct.
Remember, there are labs all over the country, even the U.S. that actually
we have our own too. I'm
work
sure.
on this biological weapons, right? If you go down to Rockville, Maryland, they have things happening around the country, right? And so it's not highly unlikely that is happening. If you look at Ebola crashes as well, Ebola out of West Africa, notice when people were coming to New York. And the Americans that got infected, they were all doctors and scientists that came out of a particular region, right? It was not the average person that was getting infected. Remember?
Oh, yes.
It was a doctor, that got infected. So so these things just break out of the lab. So I think it broke out. They didn't take it seriously. And here we are. Because if you go back, actually, to look at the idea of it came from bats. How long are these people in China been eating these bats? For years and years, if they actually eat bats, right? Why now?
Yeah.
You have this outcome. So it's not... Actually, I don't think it's a far-fetched conspiracy. I think actually last week we had the data from
the State Department.
State Department.
The State Department wire transfer warning about the lack of security at the Wuhan biological facility.
Correct. So yeah, it's not far-fetched. That is actually a much better conspiracy than 5G.
Exactly. Don't bring...
This is more realistic than 5G, right? And so
the thing that made me think that way is because the government has never reacted like this ever. To any of these type of flu viruses, H1N1, swine flu. We've never reacted in this kind of way, shutting down the whole world.
Correct. It's a whole world, right? It's not
exactly.
regions, the entire world.
Exactly.
The whole world is shut down. So that made me think like maybe they know something we don't. And then I see our elected officials. They're really not practicing anything that they're telling us to practice. They're not social distancing. They're not wearing masks. They're just doing whatever they want to do. So I'm like, they know something we don't, and they probably have their vaccines and stuff already. They're good.
They're on deck.
And they trying to figure out how to get it out to the masses, but they got it in doses on how to, you know what I'm saying.
No, I work in drug development for a long time, right? So I've brought a lot of drugs in the market, legal drugs.
Legal drugs. He means legal drugs.
Right?
No bricks. They all come in bottles.
legal drugs.
with prescriptions.
Yes, some use illegally off label, but large drugs in the market. But I'll tell you that right now in this particular space, there are a lot of companies and investors putting money behind research to come up with the right vaccine for certain things. Is it true that based on your social economic status that you have better access to healthcare and different kinds of drugs? Correct.
100%.
Right.
Absolutely.
Yeah, correct. So that there are drugs that people are tested that you might be able to get access to. If you're the prime minister or you're a top celebrity like Ja Rule, you might get access to that. Right, but the average folks like myself, you might not get access to that.
And also, too,
let me tell you.
Go ahead.
I don't mean to cut you off, Lisa,
No,
but
go
I
ahead.
tweeted about this the other day, and I was just saying that a lot of rappers with these chains and these cars, and I was just saying, hey, listen, fellas, the only thing that counts right now and the most valuable thing to you right now is your area code, because I'm telling you where I'm at. Oh, they taking care of these rich folk over here. They do. Trust me, they had the testing thing here early. You can go test, rapid test, all kind of stuff. And I'm like, see, this is the difference. In the hoods, they're suffering. Out here, they're spoiled with it. They have so much. They're like,
and Ja Rule, and we were talking with Borough President Eric Adams, Brooklyn Borough President Eric Adams, and also too, it's like the statistics. Last week 2 weeks ago almost now, we're reporting the death rate for African Americans and Latinos is twice that for whites in New York City. So it's and also economically, there's an economic disadvantage with that too. But to your Wuhan thing, there was a novel people were talking about, this 1981 Dean Koontz K-O-O-N-T-Z.
I seen it. I read it.
Did you read that?
Yes, I
what's
did.
it called? The
Darkness.
The Eyes of Darkness.
Yes.
Eyes of
to
Darkness.
the T. Did you read that, Dr. Manny?
Yes, I did. Yeah, no, I read it.
What do you guys think? I haven't read it.
To the letter.
Correct.
He described it to the letter.
Correct. And if you go back, actually, if you listen to Bill Gates giving a talk, his TED talk not long ago, talked about a similar kind of pandemic. If you go down, and Obama in 2015 talking about the exact same kind of thing. So the idea of pandemics has not been like
it's not brand new. And all the movies. I mean, look at all those movies about pandemic.
Correct. Remember the anthrax stuff back then? Remember anthrax, where someone was mailing out anthrax?
After 9/11,
that came out of a lab.
Anthrax. Now, am I correct? Anthrax was in the lab too. That was an accident as well. Yeah.
We never found out who leaked it from the lab, right? But this was from the lab, right? So it is reality that a lot of viruses have been out of labs, right? But in this case, we will never know. It's one of those conspiracy things that no one will ever say, yes, we did it. But now we know, for example.
But the indicators are there. There's always fingerprints. When there's that much
Even
going on,
the government now is telling us that they have evidence that it came out of a lab in China, right?
There's other things. There's something else I want to bring some light to, man. And I think this is very important that we say this right now. Racism is not cool on any level.
100%.
So I see people are being racist towards, Asian people in America. And I see the very sad thing that's going on in China with the Africans.
Right.
This is not cool. This is not who we are as people. This should not be a finger pointing situation between races. We're all in this together, and I think we should all just take a moment to step back and kind of analyze and understand what we're going through. This is a worldwide pandemic. This is not,
one area or one country.
This is not subjected to one area or one country. This is everybody, and I think this is the time. We need each other. We should, spread love and be together on this. And it's sad to watch some of these things going on, man. It's really, really sad.
No, absolutely. Rula, I want to ask you to give a shout out to Carmen Quinones from the president of the Frederick Douglass Houses, your friend. They won.
Hey.
I forget what country you were in during the summer, but they have an award waiting for you there at Frederick Douglass.
No doubt. We got to get that. I got to go get my award.
All right. Let's take a call or two, okay?
Okay.
And we'll hear from some of these first responders here. Let's go to Tina. Tina, hi, you're on Hot 97. Go right ahead. Hey, Tina, you're on the air. Go right ahead.
Hi, can you hear me?
Yep, you're on the air with Lisa,
Hi.
Dr. Manny, and Ja Rule. Go right ahead.
Oh, my God. I can't really believe I'm on the phone with Ja Rule, but that's amazing. Hi, how are you? I'm Christina. I'm from New Jersey.
See, I should have been a rapper. I should have been a rapper.
No, this is like a Dave Chappelle skit. We got Ja Rule on the line.
Are you making fun of my radio skills? Wait a minute. I'm an award-winning broadcaster and a serious reporter. I want you to know that, okay?
Oh my God.
We love you, Lise.
So I'm a nurse.
Thank you, baby. Thank you. All right, Tina, give us first of all. You're a nurse, right? So thank you for what.
Yes,
thank you
I'm a
very
nurse
much for what you're doing.
I'm a nurse in a hospital in New Jersey. I'm not in an ICU or ER, but I'm in a labor and delivery unit. So, we're delivering babies. And, we're keeping ourselves really safe and really supporting each other. But my question is, what we've been told, and, we even got, emails or letting us know for a couple weeks now that if we are if we contract the coronavirus at work, that they will pay us for the first 4 days, because we do 3 nights a week. We do 12-hour shifts.
Right. You do
But
4 on, 3
that,
off. Okay.
Yes, and they will pay us, but we're using our own accrued time. Okay, so they're not paying us. That's our time. You understand what I mean?
Yes.
And they're saying beyond that, then it would be, we wouldn't be able to use our time, and we would have to either go and collect almost like a family leave, like you can start collecting that if you would go beyond that point. I don't understand how we can be forced, if we contracted at work, to use our own accrued time.
I don't understand that either. Dr. Manny, what do you think about that?
We have emails about it, and, it's official. That's what it is.
It's another bad decision, right? You want people to be on the front lines and sacrifice their lives to take care of people, but then if they get sick, then it's on them.
Right.
Right. So you don't want to give them PPEs, but if they get sick, it's on them.
Right. Which is terrible. Tina, how are the moms doing? Because that's got to be stressful. That's got to be stressful for the new moms, especially the first-time moms giving birth in a hospital now. You're surrounded by all these people, fighting for their lives in this deadly disease. How are they doing?
Absolutely. It is. It's stressful for them, and it's a stressful thing anyways, but it's also a really amazing, happy time when you think about when you had your own children. It's like the most, it's one of the most joyful things that you'll ever go through. So it's really interesting, because on one hand it is a scary time, but it's such a beautiful time for them that we really do try to still keep that very special for them as much as we can.
That's why nurses, you guys are my heroes. Ja Rule, give her a quick word here, and then we got to take a little break, please.
Man, we appreciate you guys. I just want to say thank y'all for y'all service and work right now. This is a very trying time for everybody, and you guys are the ones that's really dealing with it the hardest and dealing with it the most. So we appreciate you.
Brian, hi, you're on Hot 97. Go right ahead.
Hello?
Hey, Brian, you're on the air. Go right ahead.
Hey, how you doing, Lisa?
All right.
I just want to say thank you for taking my call. I really appreciate it. I'm a New York City firefighter. I actually just got off my shift right now.
Oh, wow. Thank you for what you do.
Thank you. Thank you for using your platform in a positive way. I really appreciate you guys. I just want to let you guys know, as a first responder myself, I want to say a thank you to all hospital workers. I have family members that are in, and I don't think everybody realized how serious this was and how serious it still is. Coming from a first responder role myself, we still see this on a daily basis of the deaths, and the way strategy and protocol actually has to change to adapt to this.
Are you talking about the do not resuscitate?
Yeah, mainly the do not resuscitate. Normally, I started off on the EMS portion of the fire department. Okay. There's strict protocols as far as what you do in those specific situations, and the way that this has completely altered it as far as, it's like 10, 15, 20 minutes of resuscitation, and if it's not there no more, that's it. It's gone.
Exactly.
And there's no there's no transport. There's no nothing. I don't think people realize the seriousness of this. I think you guys are using the platform great. I really appreciate what you guys do as far as your tools and reaching out. I just feel that this is definitely a time where we need to see how coming from, I am a firefighter, but coming from the EMS portion, they are highly underappreciated underpaid, underrecognized. They are in extreme danger as far as this whole pandemic goes. Exposure, right? And I mean hospital workers as well too.
So, Brian, let me ask you this because we had Oren Bartholay yesterday, the head of the EMS union, on the phone. I posted last night on my Instagram and Twitter at Lisa Evers the directive that came from the New York State Department of Health, where it's basically after 20 minutes you don't resuscitate anybody, but even if they apparently look dead and you can't use the defibrillator on them and get them back right away, they're supposed to be presumed dead, and the body's left there in the apartment or the house for sometimes as long as a day or two, and who knows, in NYCHA it's been even longer. That's got to be taking a toll mentally on people like yourselves, the first responders, that you guys got into this because you want to save lives, and not knowing that you're
it's
not
crazy. You're 100% right. I mean, aside from the toll it takes on the family, there's times where we get called back to that scene because the family had no choice but to either say, we're going to let them go here, and now we need to get called back to pronounce, and it's just
heartbreaking.
It's heartbreaking. You've seen some of these stories of these first responders on the news, and to try to shelter your feelings from that, you can only do it so much.
Yeah, and you can only stay professional, and then after a certain point of time, it's just like it all catches up to you. It's got to.
It is. These healthcare workers and these EMS and the first responders, they're tired. They are doing tireless shifts of this, and it's saddening because at some point it's numbing.
No, it is. Rule, what do you, Brian? Thank you so much for what you do, and thank you for highlighting the work of these. Your fellow first responders with EMS, okay? With the EMS.
You too as well, Lisa. Thank you for your platform. Ja Rule, thanks for everything, man. I really appreciate your guys' voice. You guys help us out a lot. I listen to you guys every day.
Thank you too, man. Appreciate it.
All right, Brian. Thank you so much. Rule, this has been something that we've been talking about for a couple of weeks on the show. These, what they call the DNRs, the do not resuscitate. It's basically wartime, and really, really tough. And yesterday we're asking, why are they tightening? Why are they making it even shorter amount of time to save somebody when now supposedly the deaths are going down? Why do you think that?
Correct. So these are people dying, from things like having a heart attack or having a stroke, right?
Which may or may not be COVID related.
Correct, which is not COVID related. These are people having traditional emergencies that would normally call 911 for, right? And they don't have enough time to take care of them. But the biggest impact here is on the family members that get to deal with this particular crisis, and the healthcare workers, like the paramedics that are there, and how they handle this. Rule, I mean, being a celebrity, I'm sure you've been exposed to crisis as well, right? So this is, for the average person, this is a one-time kind of thing, right? But so how do you cope with these things, and what kind of advice can you give, to the listeners about, this is a big crisis moment, and how do you manage this?
This is very scary. I'm just listening to the fire, the firefighter when he was talking. I forget his name. But this is, I don't know how we start to dig out of this. Is it, my question is really for you, Doc. Is it a vaccine? Is some type of should we come back outside normally, not knowing what this is and how it affects people? I've seen a story yesterday that somebody said. It was two stories that kind of just took me back. One was about somebody had a stomach pains, and it was due to COVID, and that was their symptom. And another one was I read something about somebody getting their leg amputated due to COVID. And so now I'm like, well, what are we dealing with? What is this? What is this, a cold? Is it, what? I'm very nervous of all of the different stories and different information that we're getting. I think people should really just listen to what they're saying, stay inside, stay home. If you don't have to go out, please don't. And the first time responders, you guys that are on the front lines, be very careful yourselves, because they also, I don't know, man. This is very, very, very scary times. But saying that, everybody should have hope,
right?
And have faith that things will get better. Things will be back to normal at some point. The economy is down, but all of those things can be fixed. Money can be, made. Money can be,
We can rebound back
we
from
can
it.
get through that. Yeah, we can rebound back from that we have before. And these times of crisis, you know, it's been times that we've come through this stuff before. So I don't know, Doc. I'm
Yeah, from the
I'm
vaccine
just
perspective, I know you mentioned the vaccine piece. How do we get back to normal from
Yeah, how
this?
do we get back to normal? Can you give us some hope, please?
Correct. So the
'Cause we have
ideal
a lot of people on not getting health benefits, a lot of issues that people are having with being sick and not being able to get paid time off from work. That's a whole bank of phone callers right there.
Correct. So there's two approaches, the long-term solution and then the short-term solution, like the now solution, right? So right now, as of today, there's no vaccine today, but there's research going on vaccines. So in the ideal world, I see 12 months from now, 18 months from now, there's a vaccine or multiple vaccines in the market that people could get vaccinated just like you get a flu shot. And then we're back to normal because at this point, everyone has the antibody, right? I mean, there are people that will still die from COVID-19 infection, but those are people at higher risk, right, because of other conditions they might have. So that's one side of it. So that's the ideal world going forward. Vaccine, yes, that's the biggest
game changer. That
the
would
most
be the
realistic
game
way.
changer.
Correct, and they could have multiple vaccines. There's a lot of research happening on that. But from now till then, there are a couple of things. One is testing people and seeing people that have been infected. So Rule mentioned, for example, he might have been sick. Maybe he was exposed or not. So if we find out he has antibodies that he was sick before, that he recovered, then now the question is he immune to getting sick again?
That's my question. Could he get, if he did have that, in fact, and other people that are in that same situation, could he be immune to it now?
So we don't know, but that's the belief. The belief is that when you get infected with this, that your body, if you recovered, that means you actually could be protected, right? But we don't know that. But that's the idea, and the idea behind the vaccine as well is to take the blood and plasma from people that recovered, right, to help fight this going forward. So that's the ideal situation, and to get there, everyone has to be exposed to the virus, whether through a vaccine or through some other way, right, to say you're protected.
Wow.
Just like chickenpox. I mean, I'm not saying it's exactly like chickenpox, but I'm saying the concept, right, of herd immunity is similar to that.
And then also this mass rule. The other thing that Dr. Manny was and some of his colleagues were working on, and it's been tried in some of the hospitals, and I think it's going through approval, like independent testing right now, verification. These mass, long-lasting, like microban type disinfectants or
Correct.
of public areas. So, like, for example, if a concert, like a theater or public places, buses, subways, all of that. Give us a little hope with that real quick.
Correct. So we are working on that as well. We're working on some technology that could be able to, protect nightclubs and concert halls and actually big venues, right? With nanotechnology, where we could actually spray products on surfaces that could actually last for up to 90 days. We have
like repel, and it repels the virus.
Correct.
So it doesn't stay stuck on there like it stays on. It would stay stuck on like a counter or a doorknob or something like that.
Correct. The concept there is if you spray it on a table or a doorknob or in a concert hall, any virus that's there or bacteria is killed. And even after that, if any virus touches it, after that is also killed, right, for up to 90 days. So it's a game changer piece of it. So we are in active discussions with the EPA and everyone else.
So stay tuned for that. But Rule, there's some hope out there. It's pretty.
There's some hope out there.
When you hear the people on the front line, people are really going through it with the uncertainty. And I think the biggest thing, I mean, we can't solve all the problems, we can't investigate all the stories, but the important thing is that everybody knows that there's people that care. And what about, you want to just give some final words here, because we're coming up to the top of the hour, Rule, like just encouraging people and
let's end this on a good note.
Yeah, I don't know. Maybe can you sing to it? Can you just do like a little freestyle for us live, or sing to us?
Everybody living it up and say, I do. Let's live it up, baby. Let's have some fun, man.
Exactly.
I'm excited. The Michael Jordan documentary is coming on early. It's coming on tonight, so I'll be glued to the TV watching that at 9 p.m. tonight. And I think the Teddy Riley and Babyface battle is back on today at 5 o'clock. I think I'm not sure, but yeah. So if you try to pass some time and those two things could do it for you today.
Okay, and your final message, since we're in the mood of love here and peace, love, peace, joy, and harmony, to 50 Cent, because of all the talk. That's what I'm getting text messages about right now. What's your message?
Joy to the world, the Lord has come.
No, it's joy to the world.
Happy Sunday, everybody.
Wait, isn't it joy to the world?
You see my hat, Lisa? My hat says it all.
All good, never better. But is it your verse? A joy to the world, the rule has come.
Yes. I should have switched the words.
You can do it. We still got a minute. You can do it.
This was great, man. To everybody that's watching, man, listen, stay positive, stay home, stay safe, stay strong. From the rule, I love y'all, man. Lisa, thank you. Dr. Manny, we appreciate you. Everybody that's coming together to try to give information and get the word out there to help. We appreciate y'all. Hot 97 love.
All right, Ja Rule, thank you so much for being with us.